Hello, this is Dr. Paul Firnhaber here at Lincoln Disc Nutrition in Lincoln, Nebraska, and today we have another 10 minutes of truth. So today I have a very interesting and important article from Harvard University. The name of this article is All Disease Begins in the Leaky Gut, Role of Zonulin-Mediated Gut Permeability in the Pathogenesis of Some Chronic Inflammatory Diseases. This article was written by Alessio Fasano. He's the head of mucosal immunity at Boston Children's Hospital in Boston, Massachusetts, and he's also a professor at Harvard Medical School in the gastrointestinal division. And he's written a very, very interesting and important article on gut permeability, or what we call leaky gut. Now, I want you to understand that this guy is a big name in this field of study. He's published 183 articles that I know of, and this is one of them. And this is published in a journal called F1000 Research. It was published in 2020, so it's been out about 3 years. Now, the premise of this article is that many diseases begin with gut permeability or problems in the GI tract. So to explain your GI tract, you have a one-cell lining of your gut, and those cells fit together very tightly like this. What happens is when they start to unwind and start to come apart, food particles, undigested food particles, bacteria, bacterial toxins, microorganisms begin to get into the blood. Your blood sees those things as foreign invaders, starts attacking them, creating inflammation and disease processes. So what Fasano is saying, what Dr. Fasano is saying, is that a lot of diseases in our culture are due to gut issues, specifically leaky gut issues. Now, I've been talking about this in my office for 15 years now, but now we're seeing really solid research come out of very prestigious universities that's reiterating this and talking about it very specifically. And so what Dr. Fasano said is that he listed multiple classes of diseases that are caused or associated with leaky gut. And I want to talk about those. Number one is accelerated aging and lifespan. When your gut is leaking, you age a lot faster. You don't have as much muscle mass, as much muscle strength, and it shortens your lifespan. So accelerated aging is oftentimes due or associated with gut permeability. Number two is autoimmune disorders, celiac, type 1 diabetes, inflammatory bowel disease, multiple sclerosis are all autoimmune disorders that are associated with gut permeability. And that may be one of the first places you need to look and you need to treat in these diseases. Number three, metabolic disorders, obesity and the complications that go along with it. So people that struggle with weight, according to Dr. Fasano, have gut permeability issues. And gut permeability leads to chronic inflammation and chronic health issues. So if you struggle with your weight and you can't seem to do anything with it, he would say, or I would infer from his article, that you need a gut permeability test to see if that's an issue. And I'll talk about that a little later here in this 10 minutes of truth. Number four, intestinal diseases. Irritable bowel syndrome is a autoimmune disease due to chronic intestinal permeability. Number Number 5, cancer, especially the type of brain cancer called glioma and liver cancer, are both associated with intestinal permeability. So think about, people being treated for liver cancer or brain cancer. My question would be, has anybody bothered to check for gut permeability? Because that's an issue according to him. And by the way, he had many, many, many supporting references in his article to support what he was talking about. In fact, let me just look at how many references he has. He had 112 different references in his article to support what he's talking about here. Number 6, neurological inflammatory disease, autism spectrum disorder, schizophrenia, major depressive disorders, chronic fatigue syndrome, encephalomyelitis. All of these issues are associated with leaky gut. So think of it like this. Look at all these kids that have autism. How many of those kids are eating terrible diets? How many of those kids are eating diets that causes their gut to leak, that causes intestinal permeability? That should be checked out, according to Dr. Fasano. Now, what are the causes of leaky gut? Let's look at some of that. Well, first of all, some of the causes of leaky gut are the very things that physicians do to try and help their patients. Chronic antibiotic use, non-steroidal anti-inflammatory drugs like ibuprofen, acetaminophen, Tylenol, aspirin, birth control pills, steroid hormones like prednisone, long-term prednisone therapy, chemotherapy, antacids. How many people that you know are on proton pump inhibitors, things that decrease stomach acid? These are all causes of leaky gut. Diets high in wheat, sugar, and processed food, chemical additives. So think of breakfast, most breakfast cereals, that fits into. A lot of things that people eat, the standard American diet contain this. Very bad for your gut. Next thing, microorganisms, parasites, bacteria, mold, and mycotoxins. So if you've been had long-term mold exposure, it's possible, if that's hanging around in your body, that could be causing gut permeability. Nutrient deficiencies, zinc, B6, vitamin A, and certain amino acids. Your gut needs these to be healthy. And last but not least, are food intolerances. Wheat and grain, dairy, lectins. Plant lectins are the parts of the plant that protect the plant, and plants that are high in lectins are like tomatoes, cucumbers, bell peppers, potatoes are all high in lectins. There's a book out called The Plant Paradox by Stephen Gundry, who talks about lectins in his book. Now, not everybody has intolerances to lectins, but there are a lot of people that do. Peanuts, eggs, sugar, and soy. All of these things can be sources of food intolerances in people, and chronic food intolerances, when you continue eating that food, can cause intestinal permeability. And finally, lifestyle choices. Lifestyles that are very high in uncontrolled stress, unmanaged stress, nicotine, and chronic overeating. So what do you do to find out whether you have intestinal permeability or not? Well, there happens to be some great tests out there that test for that. Number one is we do what's called a Wheat-Zoomer food intolerance panel. And this not only tests for intestinal permeability, it can show, is your intestine permeable and how bad is it? But it will show, are you allergic to any part of the wheat complex? And if you are, you need to stay completely away from wheat. And then, in terms of correction, a leaky gut can be corrected, but you got to do certain things. You got to avoid the foods you're intolerant to. You might need to stay off some pharmaceuticals, change your diet, and then take specific nutrients which help heal and seal your gut. And it can take from anywhere from 6 months up to 2 years to heal a leaky gut. If you spent 10 years abusing your GI tract with any of this, and that's caused leaky gut, you can't get over that in 3 or 4 weeks. Just like if you spend 10 years gaining 100 pounds, you can't get over that in 3 or 4 weeks. It's going to take a while for you to lose that weight. Just like if you've got leaky gut and you've abused your GI tract because of how you eat, the amount of stress you're under, the pharmaceuticals you've taken, it may take 2 years of working hard, taking the right supplements, having the right diet to repair your gut. But that may be the only way that you can get over a long-term chronic autoimmune disease or several of the other things we've talked about. So if you're interested in how to do this, we do this kind of testing in our office. A leaky gut test involves just drawing 1 tube of blood, sending it off, and 2 weeks later you get the results. We can sit down and go over it with you. We can find out if you're intolerant to certain foods, and then we can begin a leaky gut repair program. So that's all I have for you today. Next Tuesday evening in my office at 6:30, we're doing a talk on testosterone and male hormone issues. If you have issues with that or you want to learn more about it, please come and find out. That's 6:30 next Tuesday in my office. I'll see you next Wednesday for another 10 minutes of truth.